So we're going to walk through the heart model now. So there's a few different models, but they all have the same parts on them. You just have to kind of familiarize yourself with the different models and what's what. I will tell you, if you look at this model, you notice that we've got red vessels, and here these vessels are purple. These would be akin to the red and blue vessels on this model. So normally we save the purple vessels to indicate a capillary bed. Generally, red vessels, of course, are arteries, and they're carrying oxygenated blood, and the blue vessels are veins, and they're carrying deoxygenated blood here and here. We do have a couple of exceptions that we'll talk about, and those are the pulmonary vessels, and we'll discuss those here in a minute. So I'm going to start with this model here. So again, just to orient yourself, here is the apex, the base, this groove here, which is the anterior interventricular sulcus, is separating the left ventricle from the right ventricle. The atria are under these here, where these little auricles are. So the atria are going to sit above the ventricles. But the first thing you want to focus on are the major great vessels coming off of the heart. So first off, this vessel here that's coming off of the right ventricle is the pulmonary trunk. It's going to split. You can see it splits here and back here. It's going to split into a left and right pulmonary artery, which are going to take deoxygenated blood to the heart. Now notice, this is I said it's an artery, but it is purple, and it's purple because it is carrying deoxygenated blood. Normally arteries carry oxygenated blood, but this is one of those exceptions. So those vessels are going to take blood to the lungs, drop off CO2, and pick up carbon dioxide. Right behind this pulmonary trunk is the aorta, and the aorta is going to consist of the ascending aorta, the aortic arch, and then the descending aorta. There are branches that come off of the aorta. The first branch here, this first of three, is the brachiocephalic, the right brachiocephalic. This would be the left common carotid, and this is the left subclavian. Behind the aorta, I'm going to spin here like this, you can see this purple vessel, so you know this is a vein. This is the superior vena cava, and it also, you will have an inferior vena cava. Both of these are going to feed into the right atria. So you can see this one's coming in from here, and the inferior would be coming in from below. If you look on this model here, you can see a little bit better. They've got a little bit more of the inferior vena cava attached to it, but this is going to take blood from anywhere in the body below the level of the heart and bring it back to the heart, whereas the superior vena cava is going to drain all the blood above the heart into the heart. So superior and inferior vena cava. Now, once blood goes to the lungs via the pulmonary arteries, it's going to drop off carbon dioxide, pick up oxygen, and that is going to travel back to the heart via these vessels here. So you've got these two and these two. So this would be left and right pulmonary veins. So these are veins. Veins normally carry deoxygenated blood, but in this case they're red because they're carrying oxygen, because they just came from the lungs where they picked up oxygen. So those vessels are going to drop oxygenated blood into the right atria. So here you can see in here, right atria. All right, so those are the major vessels. I want to point out a couple additional things. So we mentioned here was the anterior interventricular sulcus. That's the front of the heart. And then on the back of the heart, same thing here, the posterior interventricular sulcus. Now we're going to open this up, and I'm going to look through, we're going to do the trace of blood as it enters back to the heart and then exits the heart eventually to the rest of the body. So he said that blood's going to come in through the superior and inferior vena cava. It's going to enter into the right atria, pass through this valve here. This is the tricuspid or right AV valve. The blood's going to enter into this, which is the right ventricle. Now remember that we said these string things are called the chordae tendineae, and they are going to attach to the papillary muscle. These strings do not open the valve, they don't pull the valve open, but instead they prevent backflow of blood into the atria as the ventricle starts to contract. So we've got papillary muscles, chordae tendineae, tricuspid valve. When the ventricle contracts, it's going to push blood out through this. This looks like the top of a molar. This is the semilunar valve of the pulmonary artery. It doesn't have any of these chordae tendineae on it. It's got these little cusps, but they're going to open. Blood's going to flow out the pulmonary trunk to the left and right pulmonary arteries to the lungs, drop off CO2, pick up oxygen, come back via the right and left pulmonary veins. That blood is going to come into the left atria, pass through the bicuspid valve, the left AV valve, or the mitral valve. They're all the same. Use whatever term you prefer. Into the left ventricle. Again, you've got chordae tendineae and the papillary muscles. And then from there, when this ventricle contracts, it's going to open this valve, which is the semilunar valve of the aorta, or the aortic valve. That's going to push blood out into the aorta, which will then transport it through the rest of the body. Now we do have this wall here. This is the interventricular septum, which is separating the left and right ventricles. You would have a similar thing up here separating the atria. You'd have the interatrial septum that's going to separate the left and right atria. You also have, I'm going to show you on this front piece here, we mentioned the pectinate muscles in the atria, and then these muscles here are the trabeculae carnae in the ventricle. So one other thing here is the layers of the heart again. So remember that the thick muscle of the heart is the myocardium, myo for muscle, so the walls of the heart, the meat of the heart is the myocardium, and that's most of it. The outer portion is the epicardium, and the epicardium actually will kind of join to form the pericardium. There's an outer and inner pericardial layer, which I don't have on these models, but if the outside is where the epicardium would be, then you have underneath that the myocardium, and then the inner sort of smooth layer here is the endocardium. This is simple squamous epithelium. It's going to just make a nice smooth surface area for the blood to pass through. So now let's look here for a second at this. So we said that here's the heart, here's the vessel that's taking blood around to the whole rest of the body, and we said these are the first three branches off of the aorta. That's actually not true. We do have branches that come before this, and they're extremely important because the heart takes care of the heart itself first. So what that means is, if you recall, with all these blood vessels, the only place where you can exchange oxygen for CO2 or get nutrients in or out of the blood is in a capillary bed. So while the heart, this whole right side of the heart is only seeing deoxygenated blood, the whole left side of the heart is only seeing oxygenated blood. So obviously, if the heart could absorb nutrients from the blood directly, this half would only be getting deoxygenated and nutrient poor blood, and this part would be in good shape, right? But the heart can't just absorb stuff from the blood. So we have to go through a capillary bed. Now remember, we go arteries, capillaries, veins, back to the heart. So we've got to get from out of here via an artery through a capillary bed where we can then exchange material. So the first branch off the aorta is this here, this, and this. These are the left and right coronary arteries. They're going to bring blood to the muscle of the heart, to the myocardium. So here, all these vessels that are sitting on the surface of the heart, those are part of the coronary vessels, coronary arteries, coronary veins. So the coronary arteries are bringing blood to the muscle of the heart, where that will go through a capillary bed and they'll exchange nutrients and gases. The coronary veins will pick up the used up deoxygenated blood and dump it back into the right atrium. So first off, let's just run through a couple of these vessels. So we said that coming off of here, you're going to have your right and left coronary artery. They're hard to see on here because they're kind of covered, but they would be coming out like this and out like this. That left coronary artery is immediately going to branch down here. This is the anterior interventricular artery, or sometimes it's referred to as the widowmaker. It is one of the vessels, because it's feeding this whole left side of the heart and a lot of the meat of the ventricles. If there's a blockage in there, then all of that muscle is going to potentially could die. Major myocardial infarct. If we continue around here, this is the circumflex artery. It's going to come towards the back part, posterior part of the heart. Over this way, coming off of the right coronary vessel, you are going to come down this right corner here, this right edge. This is the marginal artery. As far as the coronary veins go, this one that comes down the center here is the great cardiac vein. That's the major one that you should be familiar with. There is a middle and a small cardiac vein that are going to kind of come around on the sides. But the other one that you really want to focus on is this. This is the coronary sinus. All of the veins are going to drain into the coronary sinus, and that coronary sinus is going to drain into, so it's coming into here. This is the inferior vena cava. This dumps in to the right atria here. A couple other structures to be familiar with. This piece in here, if you see this little indent right there, that is the foramen ovale. This used to be the fossa ovalis in fetal during development, and after this will normally close. If it doesn't close, it's can be obviously very detrimental for the health of the child if they have a hole in their atrium, and it will take a while for that to they have to grow a little to be able to go in and repair that, but generally it will close and you'll have this little remnant where there was an opening, and this remnant is the foramen ovale. Now the other piece that you have that's a remnant from fetal development, I'm going to use this model here, is this here. This is the ligamentum arteriosum. The ligamentum arteriosum used to be an opening called the ductus arteriosus, where we would have connections between these two vessels, because the developing embryo is not using their lungs, so we can bypass the lungs. They're getting their oxygen from the mother, so we don't need to shunt blood out to the lungs, because those are non-functional.